Let's bring Dr. Joe Congini to the show, Akron Children's Hospital. And Joe, thanks for joining us again this morning. A chilly Wednesday. What do you have for us today?
A little chilly Wednesday. Yesterday, though, on Tuesday, we tried to warm it up a little bit with some of the Giving Tuesday, some of the really great causes that people gave to, and it's kind of inspiring as I saw, a lot of people giving to different charities and other things on this Giving Tuesday in the community and beyond. But one of the things I have to admit I'm a sucker for, and I watch it about every couple of years, was if people got a chance to see the Jim Valvano talk again, the Jimmy V Foundation speech, the kickoff for the cancer research, the V Fund. I don't know if you got a chance to see that. If any of your listeners have never heard that speech, it's one of the most inspiring 7-minute speeches that's on YouTube. I got caught up in it again last night. And so a great day to kick that off. And the injury that I want to talk about is, as Jimmy V talks about in his talk, is, kind of find what your dream is, pursue your dream, live with passion. I've been so lucky enough to get a chance, oh my gosh, weekly to get a chance to go on with you and talk about some of the issues in sports medicine. One of my loves, sports medicine for kids, to get to work with some of the great teenagers and athletes and inspiring kids around the community that I get to work with. So really, I had to just take a step backwards and be thankful for all the great things I get to do yesterday. But one of the things that we're seeing back in our office again, Ray, and it's good to see, I guess, is that we're seeing those overuse injuries, particularly an injury that we try to touch on from time to time are those stress fracture type injuries that we see. And trying to explain that to people is, understanding these stress fractures come when kids are exercising or doing too much, and we end up with a microfracture or a hairline fracture in a bony area. And as these athletes try to continue to play, it just hurts all the time when they play. They keep going back and they have pain and they can't do the things they want to be doing. And it's just really hard for them to understand because they didn't get tripped. They didn't get undercut going up for a layup or, sliding into a base. They didn't hurt their ankle, but it just won't go away. And this chronic pain that they have is very often in our office, about 15% of our patients are stress fractures. Last year the Cavs drafted second a guy by the name of Dylan Windler, and he couldn't get on the court last year, and he had a shin problem, a stress injury to the shin. He had to sit out the whole year with that injury. And so I always mention also that the only injury that really derailed Michael Jordan, for those people that watched the Jordan special over the quarantine period, the only injury that stopped him in his entire career was a stress fracture that he had. So I was going to go over with you today a little bit what areas of the body, what bones are there that we see these stress fractures in most commonly, and what sports might they be due to. So the number one area is a tiny bone in the low back in the vertebrae, a skinny bone where the strong muscles of the back, the paraspinous muscles, attach. And very frequently people keep thinking, it's a pulled muscle, and these kids just won't get better over weeks or months and they can't play. And number one stress fracture is this small bone in the back as a part of the vertebrae. Any idea, Ray, what sports or activities that kids might do? You're so good, I like playing these guessing games with you, that could lead to this stress fracture in the low back that's number one on our hit list for stress fractures?
Gosh, as far as a sport, I would have to guess football.
So football players are in the top three. You're right again, as always. But they get it a lot during the off season. And what are they doing in the off season that leads to these stress fractures is they're really lifting weights. And to be the good teams and the best teams, they know they have to start right away in winter lifting a lot of weights, a lot of squat press and deadlift against those strong kids we see on Friday night. So weightlifting. But actually number one is gymnastics. And dance is very high up, where people are arching and twisting their back over and over again, 15 hours a week, 20 hours a week, very high-volume activities. And our gymnasts and our dancers are back at it again, and we're getting those stress fractures in our office. We see it a lot in tennis and volleyball where kids are arching to serve the ball a lot. So number one is low back. Number two is the shin bone, the tibia, and the lower leg. Any idea what athletes of ours are really at risk for shin stress fractures?
I'm going to guess cross-country runners.
You're right on it. So I cannot fool you. And through 25 years, you're hard to fool. So any running sports where people are doing repetitive activity, we see it, of course, in our basketball players and soccer players who are continually running, but the tibia bone. And most of those are pretty routine, and they heal in 6 weeks. But there's one or two in a really bad place in the shin that can actually cause kids to be out for a season, for 3 months, 6 months, and very occasionally even surgery on the shin bone. But for the most part, when we get these kids to rest, they heal. Number three is in the foot, the metatarsals, we call them, in the middle of the foot. And in the real old days, during World War II, they actually found these injuries and called them march fractures, because when troops were marching for long periods and distances, they'd get these fractures in their feet and these fractures in the metatarsal bones. And what sport might do you think that we would see this in very frequently?
Let's say soccer.
Soccer and basketball, explosive sports where they're cutting and pivoting and jumping, and basketball jumping. So many of our kids that really have played a lot of basketball to get ready for the season, they come in. Now, what makes them so tough is the x-rays, traditional x-rays that show the trauma fractures like falling out of a tree, they don't show these stress fractures. So we kind of make the diagnosis clinically. If they're really sore in one spot and it's swollen in that area and it's been more than 6 weeks and they just can't tiptoe or hop or walk or run, and sometimes we just call it clinically. But if we really need to know, and of course in the higher levels of play, we often have to get an MRI to show these fractures. And the treatment is almost never surgery. You see so many kids in a boot with these stress fractures to keep them from doing their sport, to keep them from resting. The majority will heal in about 6 weeks, and we like to rehabilitate them and look at their mechanics over that 6 weeks to get them as strong as possible so that when they go back, these stress fractures don't come back. So these injuries, I mean, we're really living on the edge right now in sports medicine. We hear every day of could somebody pull the plug on high school sports and other things, and we don't know. But in the last few months in our office, kids have gotten back in a big way to sports. And whenever they're back in a big way to sports and high-volume sports, we're going to see this very common injury known as stress fractures. And so they're back, and we're seeing these stress fractures very frequently in our office again.
There you go. Overuse in those specific areas. And that seems to be the theme, Joe. Wouldn't you agree, in the last 10 years, because of all this one sport training and such, it seems whether it be core muscles or stress fractures, it seems to be overuse a lot with those one sport athletes who are training those same muscles and bones 12 months a year.
You hit it as a coach, as early training. Even in junior high or elementary school, kids are starting doing the same repetitive activity. And it's why we really like a variety of activities early on, usually till at least high school. Then I think specialization makes a little bit more sense. But mechanics play a role, too. Some kids, if you watch them run, and I know you have as a coach, you know that mechanically the way they run is putting particular stress on certain areas in their foot or their shin or their back or other bones. There's other bones in the body, too, that get stress fractures. So just to be aware of the world we live in, we see a lot of stress fractures. We're watching very closely and seeing if kids are going to be able to play winter sport. Sport was so good for kids in the fall, and I hope we can get back to allowing kids to do what they love to do and getting back in these team sports. So we'll just keep an eye on it from here. But remember what Jimmy V said, the famous words that he ended his speech: don't give up, don't ever give up. And that was the Jimmy V speech that he gave. He died a few days later, but all this money that's been raised for cancer research came from the dream that Jim Valvano had. And so let's make sure that we can help our young people keep their dreams alive as they enjoy the wonders of sports.
Great stuff this morning, Joe. As always, I thank you for the time. We'll catch up next week.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center, joining us live, as he does each and every Wednesday.